Hello, everyone. Welcome to the Patient-Provider Partnership Program. I'm Frances, and I'm excited to get started. Quick reminder before we get started, please complete the consent form and the survey. If you haven't completed those yet, you should stop and make sure that you get them done before continuing on with this session. You can find the consent form and the survey as Word document links below the video on YouTube. You can check your mailbox, as some of you may have received the consent form and survey in the mail with a return envelope. Or if possible, you can get a hard copy at Shell Suite Community Resource Center. There will be a consent form and survey there for Ms. Coley to print or copy for you. If you have any questions, feel free to contact myself, Frances Gaudier, or Miss Mary Edwards. But go ahead now, pause the video by touching the center of the screen to make sure you have completed the consent and the survey before continuing on with the session. All right, now that we have the consent and survey completed, we'll continue on. Remember that the purpose of this program is to provide education and empowerment to people so that they can be more involved in their healthcare. We want to promote that and encourage people to be involved in their healthcare. We know that improving the quality of healthcare is a priority, not only in this country, but around the world. We need better healthcare in the form of good results, outcomes, and lower costs. We also want patients to have a positive experience in their healthcare journeys. This session will focus on teaching about patient-provider partnership and shared decision-making. Those are the two major concepts that we'll talk about today. We know that these two patient-provider partnerships and shared decision-making can help us overall have those better healthcare experiences. And that is really the goal, to have patients more involved in their care so they can have better care overall. We will start with patient-provider partnership. It's also seen sometimes as PPP, means the same thing. This type of partnership is really a relationship between patients and their providers. Providers can be doctors, nurse practitioners like myself, or PAs, physician assistants, the people that are guiding your healthcare and helping you make those important decisions to keep you as healthy as possible. This type of partnership requires respect and collaboration, or working together, along with trust. It's important to have respect, trust, and collaboration so that we can work and communicate well. This partnership allows us to identify goals together and determine a unique plan that both the patients and providers agree on. We can improve healthcare experiences, delivery, value, and outcome by having these partnerships where the providers and patients work together to find the best options for each individual patient or situation. We know that we need to have a comfortable environment where partnership can occur so that we can have open communications and discuss together. Some of the other key terms for this session are patient-centered care, sometimes seen as PCC. This type of care is also a partnership. It talks about thinking about the patient's preferences to help plan their care, to help guide that working together relationship between patient and provider so that each patient can have more personalized care. Having the patient as the center of their care allows us to know and consider everything else that goes on, not only with their health, but their life in general. So that way we can make better decisions overall. Shared decision-making is the second major topic. And this is the process or the action of working together and collaborating between what patients, maybe caregivers and families, need with their providers. This helps us to identify goals and make decisions so we have a specific care plan. Empowerment is one of my favorite words. You may have heard it on the introduction video, but empowerment is really our personal authority to be involved. In this case, we want all patients and all people to feel empowered to be involved in their healthcare, making sure that you know that it's your body and your life. You have something to contribute to all the healthcare workers working for you to make sure that you have the best decisions and the best care possible. I hope you feel empowered to have an active patient role. The active patient role is really important. This is using that empowerment to remind yourself that you can be active, involved in your care. We know that patient involvement can improve healthcare, and that's what we want to do. Make sure that all patients know and feel empowered to be involved. Now, patients also have the right to be involved, and this is important when it comes to healthcare decisions. You need to remember that your rights are that you are in charge. So use those to make sure that you help to guide the healthcare providers in making the best decisions for you. We know that patients should know about their conditions, their diagnoses, or their illness, as well as their options for care, like medications and lifestyle changes. When patients know what's going on, it's more likely that they can take better care of themselves and that they can also participate more because they understand the situation. Everybody should participate and advocate, which means to encourage or go for the personalized care. As a patient myself, sometimes I have had to be more involved and say, wait a second, can you explain? Or I'm not sure how I feel about that. And that's easy way of having an active patient role. I love this picture about the partnership that we can have with our providers. So let's look first at the cartoon. It says conversations should be between experts. We look at maybe the doctor on the left, and he says, I'm an expert on healthcare, which is true. Providers have that scientific knowledge and that medical background that help make them the experts on care, treatments, diagnoses, and diseases. However, as patients, we are the experts on ourselves and our life situations. So if we look at the person in the pink shirt, we can see that they say, I'm an expert on me. And that's the important partnership factor, bringing together the science and the medicine that our providers are the experts in and help us with the patient, their unique life and situation. When we bring those two together, we can really have a strong partnership to make the best decisions. If we look on the words, it's saying the providers explain and inform the patients. They give their expertise and knowledge so that we can know a little bit more about the medical situation or the health issues that we're discussing with them. The patients should listen and then decide which of the choices or suggestions align with their personal life and their preferences. Then the provider and the patients come together. When they share, then they can make the best decision for the treatment plan. We can create personal care plans together that both the provider and patient understand and agree upon by sharing our expertise and working together to put our information and heads together. There are many different levels of involvement, and the main takeaway here is that any level of patient involvement is just fine. We know that the collaboration or the teamwork can vary, and there's very different reasons for that. Some patients are unaware or not sure how to participate or how they can get involved in their care. That's one of the reasons we're providing this program for you, to make sure you know how to get involved and that it is important and you have the right to participate. We know that some patients don't feel as empowered to participate in their healthcare decisions, but now you know we should all be empowered to have a piece in our healthcare decisions because it is our body and our lives. We can share our personal expertise. Sometimes the level of involvement depends on The situation, do we have time to discuss? Individuals, maybe the personality of the patient or the provider, how much we want to share, or that patient provider partnership, the relationship, how strong it is, and how open and trusting we can be. Hopefully, over time, you can develop a strong partnership with your provider or many providers. That way, you can work together. All right, it's time for a quick break. Here's a quick video of myself and Mrs. Coley.
Make sure you take a break, go to the restroom, get some water, and I'll be right back.
All right, we'll be right back.
I will be right back.
All right, guys, just like you heard, feel free to pause this video by touching the center of the video. Go ahead and take a break. Use the restroom, get some water, maybe walk around the room a little bit, and then come on back and we'll finish up session 1. There are many different forms of partnerships. We have talked about shared decision-making, SDM, and patient-centered care, which is the PCCUC. These are important clinical partnerships that have been researched and that have strong evidence behind them. We have proof that these types of relationships and working together between patient and providers has beneficial results when it comes to healthcare. So we get a better healthcare experience. There is an issue of no inconsistent use of partnerships. Some people have different relationships or different tools that they use, which makes these partnerships hard to study in the research and hard to standardize so that everybody does the same thing. That being said, it's not a bad thing that they're inconsistent, as partnerships depend on everyone's situation and personal levels. The variations in the partnership can sometimes be because of mistrust or miscommunication, which can lead to bad outcomes. We want to avoid these issues and encourage a strong relationship that has good trust and positive communication. That way, instead of poor outcomes, we can have better outcomes for everybody. The most common example of a partnership is shared decision making. We know that communication and working together to make decisions is the best way to participate in your healthcare, and is an easy way to just have a conversation with your provider and make sure that the decisions they're making for your healthcare also align with your personal values. Some of the strengths of shared decision making are listed here. We know that it provides good collaboration and choices, so we can work together with the provider and then think about the options that they think are appropriate for our situation. Shared decision making is supported by research, and there's a lot of studies on it, which is a cool way that we know it is important and it does work. We can identify with shared decision making how patients are able and willing to change. This is an important time for patients to state what they can and cannot do, or what their concerns are with the different decisions or options that the provider is giving them. Shared decision making provides us a good forum for discussion, so we can talk about the appropriate options or maybe what barriers are in place. We can plan together to overcome these barriers and then make a personalized treatment plan. Setting goals together is also great for long-term outcomes. We know that a lot of older adults have different conditions that need management over many, many years. Having a good relationship with your provider and being involved in shared decision making helps you with better management over time. And remember, keeps you empowered to be involved in your care so you know what's going on. There are some barriers to having the shared decision-making partnership. Sometimes we can't have shared decision-making because it's not recommended or appropriate. Now, if there's a time crunch, poor relationship issues, or unclear communication, such as translator problems, or maybe we can't understand one another, then shared decision-making is not the best for that situation. Sometimes the patients or providers can make it difficult to have shared decision making. When patients are very, very sick, they're not feeling well, and maybe they're not thinking well, they cannot participate. This could include times where patients are very sick in the hospital, mentally ill, or have a severe cognitive impairment. When someone has Alzheimer's disease or is on a ventilator, those patients cannot really participate in shared decision making. And it would be best for them to have the provider who knows them well make decisions, or their family or caregiver to work with the provider. These are examples of shared decision making that we can talk through, and I hope you see what I mean. Collaboration. Remember, we've mentioned this a couple times. It's that working together and choosing options together. Here's an example. Maybe as a patient, I want to try losing weight before starting medication. So I talk to my provider and we decide together that I'm going to try to lose weight for the next 3 months. After those 3 months, I'll come back to the office. If I haven't been able to lose weight, then it's a good idea to try to start a new medication so that I can keep my health under control. This example, I think, is great because it's a great way to show how patients and providers can work together. We know that healthcare depends a lot on lifestyle choices, but sometimes it can really benefit from medication. So having the option of maybe trying one thing before the other is a great way to collaborate and work together with your provider. We can also discuss priorities. Priorities don't have to just be medical concerns about sickness, but they can also be personal concerns or issues. The example is that a patient forgets to take their medication at night and they would rather take it in the morning with the rest of their medications. This is a great point because if we're not taking our medication, then it can't work for us. So the patient talks to their provider and asks if they can change the timing of the medication to another time. I think this discussion about priorities is a great example of how easy it can be to bring up these concerns with the doctor. It's a priority for the patient to take their medication and not forget about it. So they're asking the doctor if maybe they could make that easier by changing the scheduled time. I hope you enjoy these examples because I think even if they're not directly related to you, you can understand the easy ways that we can collaborate and discuss with our providers using these partnership techniques. There's also decision aids, which are special tools that are created exactly for helping make clinical decisions. The research shows that decision aids do help with partnerships, such as shared decision making. I would put an example from the Ottawa Personal Decision Guide. Ottawa, Canada, you may know, is in another country, and they have a university there that specializes a lot of its work on making decision aids for patients. Now, these aids show a process that helps guide health or social decision making. It walks you through different factors that we need to consider so that we can make the decision easier. The first step would be to clarify the decision, what's going on, or maybe what needs to happen. And the second part, which could be split into many different processes, would be to explore the knowledge, information, your personal values, and the support that you have to make the decision. Finally, the decision is made based on the discussion with a provider or maybe caregiver and family, and then the needs. Your healthcare needs drive a lot of decisions. Sometimes we don't have as many options, but it's good to use something like an aid to help you think about and process the situation so that you know what the best decision is for you and you can discuss that with your provider. This is an example of a decision aid that's a visual. We can start looking at the bottom where it says, high blood pressure, should I take my medication? Many people are on blood pressure medications, and they're very important to keep our bodies working properly. Sometimes people need to start medication, and other times they may need to add a medication to make sure that their blood pressure is under control. If we look at the bottom, we can see one is get the facts. So that's collecting the information. Could be from providers and could be from other sources, maybe books or online. Then we compare the options. What are the particular options for you and your situation? That can come from the knowledge or, again, from your provider, who is the expert on medicine and hopefully on your personal situation. Then you should think about your feelings and your values. Number 4 would be discussion. Talk to maybe your family, your caregiver, or people that you value to get their input. Then quiz yourself. Make sure you know all the information and you can correctly make a decision based on true knowledge. 6 could be your summary, taking notes on how you think about the situation and what you think a good decision would be. You could take your summary to your provider to make it easier to talk with them about the decision-making process. We know that sometimes visuals are much more helpful, so you can go online to find different visuals or maybe ask one of your doctor's appointments for different decision aids or resources. Sometimes the visuals are made for specific diseases, like this one is for blood pressure. Here's my contact information. You all know my name is Frances, and this is part of my school work. I'm happy to answer questions or explain information anytime, as I'm very dedicated to this program and all of you who are participating in it. You can contact me to my phone or my email, as well as contact the Shell Community Resource Center if you have questions. It would be a good idea to ask for Miss Mary Edwards because she is my right-hand helper and has done a lot of work to make sure that this program is perfect for you and engaging for all of us to share in our learning. These are the references I used. Remember the little numbers at the top. In case you ever need any information, feel free to contact me anytime. Thank you for joining me for session 1. I look forward to seeing you at session 2 next week. Thank you in advance and have a great day.